we're going to begin looking at the female reproductive anatomy. The organs involved in the female reproductive tract include the ovaries. This is the homologous structure to the male testes. It produces and releases the female gamete, the oocyte. The ovaries are responsible for producing and secreting estrogen and progesterone as well, just like the male testes were responsible for secreting testosterone. The fallopian tube, also called the oviduct or the uterine tube, is a tube that sweeps the egg from the ovary into the tube with finger-like projections called fimbriae, and then it connects to the uterus where the egg will eventually implant if fertilization should take place. The fallopian tube is the normal site of egg fertilization. The uterus is the organ in which the preembryo will implant and continue to grow. It's a hollow, pear-shaped organ where the fertilized egg grows and develops. There are two major layers to the uterine wall. There is an endometrial layer, endo meaning inside. This is the inner layer where the fertilized egg implants. This layer is going to nourish the developing fetus. This is also the layer that is shed every month during menses. The myometrium is the muscular layer of the uterus. It's an outer layer made up of smooth muscle, and its job is to expel the fetus during labor and delivery. The cervix is basically the entrance into the uterus. It's a narrow entrance or exit, I suppose, out of the uterus. Taking a look here at the picture, you can see the ovary, and it's attached to the fallopian tube or the oviduct via some of those finger-like projections or the fimbriae that sweep the egg in. You can also see the uterus, which is largely smooth muscle, and at the end of the uterus you can also see the cervix, which is the entrance or exit into that organ. The vagina is another of the female reproductive organs. This is a hollow muscular organ of sexual intercourse. During sexual intercourse, it's going to accept the penis. It also acts as the birth canal during labor and delivery. And then the vulva is basically a general term to include all of the female external genitalia. Structures that you'll find inside the vulva include the labia majora, the labia minora. The labia majora are a little bit more like skin, the normal tissue with skin. Labia minora are the inner lips, if you will. Labia refers to lips, and it's made up of a tissue that's more so like what's on the inside of your mouth. The clitoris is also part of the vulva. That's the homologous structure to the glans penis or the tip of the male penis. The clitoris is going to contain the erectile tissue for the female. Taking a look here, we can see the vagina attached to the uterus, and then they're separated, of course, by the cervix. On the right, we can see the vulva. So we have the labia majora on the outside, the labia minora to the inside, the clitoris up at the top there, and then we have both the urethral openings and the vaginal openings inside of the vulva as well. Another of the female reproductive organs are the mammary glands. Mammary glands are actually modified sweat glands. They have a couple landmark structures. One of them is the nipple, and this is the structure through which milk is expressed. The areola is the circular area around the nipple, the dark pigmented area. And, of course, during puberty, the increase in estrogen release in a female will cause breast development. Another hormone called prolactin will stimulate lactation in a female. And then the last of these hormones is called oxytocin. And oxytocin stimulates what we call milk letdown or milk ejection. And just as an end note here, that those are all endocrine hormones. This here is a picture of the breast We can see the nipple in the center and the areola surrounding that, and then some of the ducts and such inside of the breast tissue that will create the milk.